length brown hair. I have on glasses with a black frame, gold earrings, and I'm wearing a leopard print dress. Our next session today will be how Social Security disability benefits planning can support a successful transition to work. The presenters will be Dr. Elizabeth Fussell with Lighthouse, Louisiana, Rose Angelosi, and Donald Leger with LSU Human Development Center. You can read the description for this session and their bios on pages 22, 23, and 24 of the conference booklet, which is linked in the chats. Presenters, I'll turn it over to you.
Good morning, everyone. I'm Liz Fussell with Lighthouse, Louisiana, WIPA project. And just so you know, I'm a white female. I have short brown hair with dark brown glasses. I'm wearing blue today, and I'm so happy that you are here. We have a lot to cover in a short time. So we want to get right to it. Ray, do you mind to advance?
Yes.
Okay.
Hey, you guys, this is Bambi. The view is showing the current slide and the next slide. You may just want to change it to where it's only showing the current slide.
Okay. We change that, please.
Okay, so while we're catching up, there are a couple things that we think that you're going to learn today, and that is going to be the different types of Social Security benefits. I know you've all heard of SSI and SSDI. Those are some of the things we will focus on. The next thing will be the types of work incentives that can help with your transition as you go to work. And then the third thing is your responsibility to report to Social Security. That is critical in this whole piece. So what is WIPA? You know, we can't do programs without doing acronyms. And so when we break it down, WIPA stands for Work Incentives, Planning, and Assistance. And what that is individualized, employment-focused benefits counseling for people who receive disability benefits and are going to work, so that you understand what is going to happen once you go to work and you have earnings. So this program is funded primarily by Social Security Administration, and it's a critical component of the national effort to improve employment outcomes for Social Security disability beneficiaries. So as I stated, WIPA is about employment. The mission of the WIPA program is to promote employment and financial independence. So as you're going through the process, we're going to be looking, are you working? What type of job do you have? Meaning, what are the hours you're working? What is the rate of pay? Those are important pieces for us. And then throughout the process, you will learn all of the different pieces that will help you with your financial independence. One more slide, Ray. So what can WIPA do for you? When you sign up for WIPA and you ask to be referred to a program, you will be assigned to another one of those words, a CWIC. A CWIC is a Community Work Incentive Coordinator, and they will help you walk through the process. The first thing they're going to do is verify all of the benefits that you have. and try to gather information about those benefits. The next thing is to identify if you are looking for assistance with employment. So we'll help you identify employment services and supports to overcome some of those barriers that you have towards employment. The next thing is to help you understand how that employment and the income earned will affect all of those benefits. So that's your Social Security, your insurance, state and federal benefits such as SNAP or housing, all of those key pieces we're going to pull together. And at the end of the day, the hope is that you will be able to manage all of those benefits and look at what types of work incentives will help you in that process. Some other things that we're going to do, and I touched on that a little bit, the responsibility of reporting your wages to Social Security. And then the whole key of managing your benefits over time. So as you report, as you're watching your benefits, you're watching your income, we're going to give you tips and tools on how to maintain that information and continue reporting and knowing where you sit with your benefits. We're going to look at your health care and see what is the best coverage. Will you maintain coverage? How long will that coverage be? Do we need to help you look for other areas of coverage? And then finally, to resolve any benefit problems that you encounter. So one of the things we like to say in our report to you is, if you receive a letter from Social Security, call that CWIC and let us know what the letter says so that we can better help you in that process. So who is eligible for WIPA services? So the first key is that you have a disability that is under Social Security's definition, that you are receiving one of those Social Security disability benefits. And I mentioned two of those, which might be SSI, and then one of the Title II benefits, and I mentioned SSDI. The next key is that you are age 14 and not yet retirement age. So all of those pieces are critical to the eligibility process. And at the end of the day, the message is employment and Social Security benefits can work together. And that's our role to help you understand what that's going to be, to give you the information that you need in order to make that informed choice of this is the route that I am going to go. It's possible to keep your insurance, and that's a key. I just mentioned that we will help you figure out what is going to happen to that insurance, how long will you have it, and then what are the possibilities of other insurance that you could search for and request. And then there is the fact that when you work, you will come out ahead financially, even if your benefits are reduced or stopped. And then the final thing is that there is a safety net, that if your benefits are lost due to you going to work, then there's a way that they can be reinstated or restarted when something happens that you have to stop work. And now it's for Ray. Thank you.
Thank you, Liz. Good morning, everyone. My name is Ray Leger. I know you do see the name Donald. I tend to go by my middle name. There's a big story behind that, but we'll get to that at some other time. We'll begin discuss. Oh, let me describe myself. I'm a Black male, short, gray and black hair, and I wear glasses. As Liz mentioned, we'll be discussing the two benefits program distributed by Social Security, Supplemental Security Income or SSI, and Social Security Disability Insurance known as SSDI, but CDBs, which is child disability benefits, and deceased widows benefits are also a category of the SSDI program. Let me begin by saying I'll discuss supplemental security income, and my co-presenter Rose will discuss more about the SSDI program. I wanted to say that supplemental security income is or has always been meant to be supplemented by wages from employment. It was never intended to be a standalone benefit that is able to support the individual during a given month. So the intent was always to have work be incorporated with those individuals receiving this particular program. It is a need-based benefit program. You're normally eligible for SSI because you don't qualify for anything else under the Social Security rules for benefits. The federal benefit rate is the maximum amount a person can receive in any given year. For 2023, that maximum amount is $914 a month. As I said, $914 a month is very difficult for an individual to be able to subsist on. SSI is adjusted by gross income that one earns during the month. And Social Security adjusts that benefit based upon the reported income that the individual informs Social Security that they're earning in a given month. By the way, if you do qualify for SSI based upon the work income that you earn, it'll take approximately 8 weeks or 2 months for the SSI benefit to be adjusted by Social Security. Gross wages during the month, an individual will have to earn at or above the threshold of $1,913 a month in order to lose the SSI benefits. Again, that's a lot of income for the SSI beneficiary. So unless you're earning at or above $1,913 a month, you're still going to be eligible to receive an SSI benefits payment. The only difference is that if you're earning below that amount, the SSI benefit check will not be $914 a month any longer. We have to explain to the beneficiary that based upon the income that they've reported to Social Security, the SSI will be adjusted down. We just don't know until the actual calculation is done by a CWIC to determine what that amount of SSI payment will look like. So even before Social Security begins to adjust the SSI, there are 2 exclusions that they apply to the amount of income that they're earning during a given month. The first exclusion is called the general income exclusion of $20. The second exclusion is known as the earned income exclusion of $65. Those 2 are combined together. Excluded from the total gross income for the month, divided by 2, and we'll look at exactly what a visual view of the SSI calculation looks like. Here you see a graphic of gross wages during the month. Now, let's discern between exclusion and deduction. Although the calculation is a deduction, it's just an exclusion of $85 from the monthly gross income. That subtotal then is divided by 2 to determine the exact amount of what an SSI payment will be for an individual. Here we have an example. An individual is earning $640 a month. That is the gross wages from the job. When you apply the exclusions of the earned and general income exclusion, Social Security is now considering $555 of the $640 the individual earned for that month. The remainder then is divided by 2. Of the $640 that the individual earned in a given month, only $277.50 is assessed by Social Security for the income that that person earned in this given month. That $277 is then deducted from the $914 SSI amount for an adjusted SSI benefit for that month of $636.50. So that is how Social Security determines the amount of how to adjust the SSI benefit based upon this person's $640 of income for this particular month. When you add the adjusted SSI of $636.50 to the gross wages of $640 a month from the job, the individual is now earning $1,276.50 per month, where they were only receiving $914 a month prior to entering the employment. So as Liz mentioned earlier, going to work with SSI monetarily is an advantage to you, especially since the individual is still, in this case, receiving SSI and will also continue to receive Medicaid insurance as a result. Work incentives. There are work incentives for both the SSI program and the Social Security Disability program. And keep in mind that work incentives don't apply to every individual who goes to work receiving supplemental security income or SSI. So the work incentives that apply to the SSI program include the student earned income exclusion, the impairment related work expense, the blind work expense, and the plan for achieving self-support. And I'll discuss a little bit more about each one of these work incentives. Only the SSI beneficiary can use the student earned income exclusion. It is for those individuals who go to work, are under age 22, and are regularly attending school, which means that they're in a learning or school setting for at least 12 hours a week for grades 7 through 12, or for 15 hours per week for individuals who may be in a work course while attending school. An eligible couple, both who are visually impaired, only one of those couples would be eligible to use this particular work incentive. In 2023, the maximum amount per month for the individual to use this exclusion is $2,220 a month, or $8,950 a year. So what this means is, if I'm working, for example, on an SSI individual who's eligible for a student earned income exclusion, each month I'm deducting the gross earnings for that particular month from the $8,950 of annual exclusion until the balance for the annual exclusion reaches zero amount. In other words, how the calculation goes is that the student earned income exclusion can allow that young individual who's just entered the workforce, that no matter the amount of income they've earned for a given month, Social Security will allow that individual to be able to receive the same amount of SSI, regardless of the income that they're earning from employment, until they reach $8,950 of gross wages for that given year. After this threshold has been met, then the individual's SSI is assessed as anyone else who may be receiving SSI and going to work. Monthly and annual student earned income exclusion amounts are adjusted upward each year due to a cost of living adjustment. So every January, just as you might see a 5 or 7% increase in what you received in SSI benefits in the previous year, the same thing happens to the exclusions per month or the annual amount for the student earned income exclusion, excuse me. The impairment related work expense is related to the disability or impairment for which a person is receiving treatment from a healthcare provider. It's necessary for work, It's paid by the individual themselves and not being reimbursed by anyone else. It's paid in a month earnings are received. The expense must be reasonable, and only Social Security can determine whether or not a particular expense is reasonable. And the cost of durable items may be prorated over a 12-month period. IRWEs continue. Individual must have receipts to prove the expense that was paid. The determination of whether an item or expense may be deducted as an IRWE is made again only by Social Security. And the request of the determination it should be made in writing in order to appeal the decision by Social Security. Even though Social Security may deny the use of an IRWE or any other work incentive, there is an appeal process that can be requested to see if special circumstances might allow the individual to be eligible for this particular work support. Okay. Here's Debbie. She's receiving $914 a month in SSI, and she has a Medicaid. She began working for a social service agency, earning about $640 a month. Because of her disability, she takes paratransit to and from work, which costs about $36 for her in a given month. The calculation here, and I hope you can follow me here, is her gross earnings is at the top of $640 a month. We apply the general and earned income exclusions of $85 from her total. Her remainder is $555 a month. We add in the IRWE or the impairment related work expense of $36 to this equation. Her countable income at this point is $519 a month. Now, what the IRWE does here in this particular formula is it lowers the countable income that Social Security is looking at to assess how much SSI that she's eligible for. Based upon the IRWE then, that is divided by 2, her countable income because of the IRWE would be $259.50. We subtract the $259.50 from the amount of SSI she normally receives. Her SSI, her adjusted SSI in this particular scenario is $654.50. As the caption and the arrow shows here, without the IRWE, her SSI or her adjusted SSI, excuse me, would have been $18 less if the IRWE had not been applied to this calculation. Her total income at this particular time now is $1,258.50 as a result of the IRWE, where it would have been roughly $1,236 if my math is correct, or generally close to that amount. So the IRWE can be used again to lower the countable income that Social Security determines a person to have. The lower the countable income, the greater amount of SSI that the individual is going to receive. Here's the blind work expense. It is for, again, SSI beneficiaries who meet the definition of statutory blindness. It allows exclusions of any other work-related items that are paid out of pocket and not reimbursed. Blind work expenses do not need to be related to an individual's impairment. And again, it's only for the SSI beneficiary, no one else. Examples of blind work expense would include state and federal taxes that an individual has deducted from their pay each month, union dues, mandatory pension contributions, uniforms that those are required to be purchased by the employee, reader services, driver services, cost of service animal care, child care, transportation costs. Even meals consumed at work can be used as a disregard for the blind work expense. And then the adaptive equipment that the individual needs that they must purchase themselves to assist them on the job. Plan for achieving self-support is the final work incentive for the SSI beneficiary. The PASS, as we call it, is an SSI work incentive, which allows a person with a disability to set aside income and/or resources for a specified period of time in order to pay for items or services needed to achieve a work goal. PASS can be used for educational purposes, where in most instances, and if most beneficiary receiving SSI understand, resources in excess of $2,000 can make them ineligible for the SSI and or the Medicaid insurance that comes with that program. The PASS is a tool that allows an individual to set aside resources in excess of $2,000 that would allow them to pay for educational expenses. Some individuals who can use the PASS for self-employment, where they're able to purchase equipment, rent a building to house their business. They can do all of these things with the PASS. The tricky thing about the PASS is to make sure that whatever the contributions into the PASS account, and you have to share that account and the information about it with Social Security, that you're able to subsist on what is left from the SSI and the work income. You can't contribute, for example, SSI benefits into the PASS account. You can only contribute what you earn from employment or a portion of that, and other resources that would contribute to the eventual goal that you've stated to Social Security. Okay. And of course, we spoke briefly about Medicaid. That is the health insurance that is attached to the SSI program. You can, while employed, continue to receive Medicaid, whether you're receiving an SSI benefits check or not. The threshold for 2023 for an individual receiving Medicaid with SSI is $37,322 a year. I've only experienced a portion of SSI beneficiaries ever earning an annual income of $37,000 a year. Some do, but more than likely that is not the case. So generally, when I'm explaining to an individual about maintaining Medicaid, I tell them not to actually be to have Medicaid be a concern for coverage, because more than likely 90 to 95% of those Medicaid will continue regardless of the income that they're earning from employment each month. As stated earlier, assets cannot exceed $2,000 at any given month, or that could cost them their eligibility for SSI and or Medicaid. The exclusions, of course, for that would be one car and the home that the individual resides in. So to have, for example, a family or friend donate property, an additional home or car, those items could lead to the eventual elimination or eligibility for those benefits. The next slide. Rose, you're up. I'll go ahead and let you go ahead and take this portion of the presentation.
Okay, good morning.
Okay.
Oops. Somebody talking?
No, it's
You ready for me? Okay.
Yes, ma'am.
Hi, I'm Rose Angelosi. Give a description of myself, a white woman with curly, graying brown hair pulled back in a ponytail. I have on a blue dress and a flower-shaped pendant with a white stone on a gold chain. And I have on 2 sets of headphones right now because I'm working 2 computers, and gold double hooped earrings. And I'm going to talk to you about the other benefit, Social Security disability insurance, the SSDI side of things. So this is an entitlement program that's funded by federal taxes, the Federal Insurance Contribution Act, FICA. You'll see that on your pay stubs, withholdings for FICA. To receive SSDI, somebody would have worked either 20 quarters before age 21 or 40 quarters for anyone else. Next slide. So these benefits are designed to partially replace income when a worker retires, dies, or develops a disabling condition that prevents them from doing substantial work. So these are benefits that are paid to retired or disabled workers, their dependent family members, or the surviving spouses and children of deceased workers. So for the purpose of today, we're going to talk about those benefits that are paid to disabled workers themselves, disabled adult children, DAC, or sometimes called CDB, or disabled widows, DWBs. Next slide. So there are a number of work incentives available to people that receive SSDI if they want to return to work. And some of these we're going to talk about today in more depth. The trial work period, extended period of eligibility, and then there's a post-extended period of eligibility. So that's I consider them phases that people move through in their return to work. There's also subsidy and special condition, impairment-related work expenses, which are the same as Ray covered with the SSI benefit. The impairment-related work expenses are available to those on SSDI, not the blind work expenses that were available for SSI. There's averaging and unsuccessful work attempt. So first, I'd like to talk about the various phases that one goes through. First is the trial work period, which is a time that people can really test their work skills while they're still getting their full benefits, no matter how much they earn, as long as they continue to have a disability. And if those earnings this year would be over $1,050 in a given month, then it would be considered to be using up a trial work month. And that amount is for anybody, whether they're blind or non-blind. So, all right, next slide. Okay, so trial work months, they don't necessarily need to be used consecutively. They really are looked at over a 5-year period. You know, does this happen? You get 9 of those trial work months available to you. So once, you know, we look at, does that happen 9 times within this rolling period? No other work incentives are used during this time. So any kind of, you know, gross earnings are all counted. So it could be gross earnings if you're a W-2 employee, or if you're self-employed or an independent contractor, net earnings from self-employment, looking at those earnings, but also for those that are self-employed, it's also based on the time that you put in a given month. So limited to an average of 80 hours within a month. So you receive your full benefit check, regardless of what's earned. And once you use those 9 months up, it's used up for that period of entitlement. All right, extended period of eligibility. So when that trial work period ends, this is a 3-year phase that they're going to start looking at what your substantial gainful activity level. They start measuring you at this level to decide if your benefits will continue or if they may be suspended. So the thresholds for these is $1,470 for people with disabilities who are not considered statutory blind, or $2,460 for those who are considered statutory blind. And that's one thing that we really look at to see how people are coded in the Social Security system to determine which rate we need to look at for substantial gainful activity. So during this period of time, if you are below that earnings level in a given month, then you continue to receive your benefits. If you're above, then you would not be due that benefit. Now, what you need to know is they're not watching that closely and turning it off and on in given months. So this is something that we as CWICs really kind of help you with, monitor whether you should be receiving checks or not. So you want to be aware, should you set that money aside, because you don't want to be overpaid because they want their money back. All right. Next slide. So the extended period of eligibility begins immediately the month after your trial work months. So once you use that 9th trial work month, you jump on this 3-year train, and that train is taken off and running whether you're working or not. Okay, like I said, if you go over SGA, benefits could be suspended, not terminated, but suspended. All right. So at this point, other work incentives can come into play. So things that can bring down what Social Security considers you earning. When determining SGA, that's a decision that looks at not only your earnings, but are there other work incentives that can help make that decision. So one that I'd like to emphasize today that I don't think people think about a lot is subsidy or a special condition. So sometimes when you're working, you may need some extra help from other coworkers or extra supervision. You may have a lower production rate. You may need a few more breaks than other people. You may not be able to perform all of the duties of the job that the employer is offering. So you may have fewer duties than other people who might not have a disability doing that same work. So when this happens, their wages pay for their work product or effort, but also the help of other people, or perhaps higher pay that might be received for the same work product. So sometimes people call this a brother-in-law deal, because maybe you're being paid more than your work effort might be demonstrating. I like to think about it as accommodations. A lot of times we are given accommodations and jobs are modified. We do get some extra help from people from time to time. So this is a way of accounting for that. Accounting for the accommodations that we receive that really is of some value to the employer. And the subsidy that the employer ranks you, needs to be realistic, in line with, what is your work effort and what are the accommodations being put in place. All right, so how subsidy works. I just want to give a little example here. So say there's somebody receiving SSDI and they're going to work at a gas station convenience store. Their monthly earnings, if they're working like 40 hours a week, so say their earnings are $1,732 in a month. Well, that's over SGA, right? So their duties include cashiering, for the most part, but then there's sometimes they have to go stock, restock the fridges with the drinks, and also go out and measure how much gas is left in tanks. And this person has some lifting and bending restrictions. So they can't really go measure the tanks easily. And they also have difficulty lifting, restocking, lifting heavy things and, putting them on higher shelves. So those are some things that they really aren't able to do. So when I talk to the beneficiary, if we think about the time that might takes, it might be about, 25% of their time really spent there could be doing this if they were taking on these tasks. Okay, next slide. So by not doing these, if you think about it, he has less duties than somebody else in that same position. So it requires some other employees to come perform these tasks, restocking the shelves. And someone else had to take on the measuring of the tanks. So if the employer would rank them, say at 80%, considering that this is like 25% of their job, 80%, Social Security, would consider them earning 80% of whatever their actual check is. So 1732 times 80%, 1385. So at that point, they might be considered under SGA in Social Security's eyes. All right, termination of benefits. So if somebody moves beyond that 3-year phase, if they're under SGA, benefits still continue. But at that point, if you're working over the SGA level, benefits would terminate. And that means that the computer record that maintains the payments is terminated. And it's the end of the period of disability entitlement. So once they're terminated, you'd need a formal reentitlement or reinstatement decision to start receiving benefits again. Okay, next, expedited reinstatement continued. So this is a 5-year period that lets you jump back in relatively quickly in the system without putting in a totally new application. So if somebody stops working because of their disability, because of the same, the original disability in which they were qualified, or if they have some kind of reduction in their work. So it has to be related to the original disability. And you have 5 years to do this once payments are stopped, right? Okay, so when you try to go through this process, there's 6 months of provisional payments while they're making a decision to see if they're going to reinstate you. And you must be currently unable to do SGA level work. And if one is reinstated, if you go for 24 months, staying under that SGA limit, then you are granted like another trial work period, another extended period of eligibility. Things start over, the whole cycle starts over. And this is the initial reinstatement period. All right, Medicare. So SSDI beneficiaries ultimately get Medicare, sometimes immediately, but for the most part, 2 years in to receiving benefits. And this can continue even if one's working and benefits are suspended or even terminated, your Medicare can continue. There's an EPMC, extended period of Medicare coverage. And this can last at least 93 months after the trial work period ends. So other things that we look at besides the healthcare and your actual Social Security benefits, we're also going to look at food stamps, SNAPs, any kind of subsidized housing assistance, Medicaid waiver eligibility, unemployment, workers' comp, VA benefits. Look at how any of these things are interacting with work and any impact of work on these things as well. And on this next slide, work incentive resources. So these links will point you to some of the things. So the SSI calculation sheet that Ray went through, that example earlier, we have a blank sheet that you can work through. And impairment related work expense request forms. So it's very important to document those and save receipts. And some information on past and so forth. So I'm going to hand this back over to Liz, right, to talk about the importance of reporting.
Yes, thank you, Rose. Just to remind you that each person that we work with, we provide individualized information. So it's very difficult for us just to answer a general question about, does this happen? So because we're gathering a lot of information about your specific situation. So when the package is complete, and we're going to try to help you to understand how is it that you report to Social Security. What I like to tell people is that this is about communication. All of these work incentives are in place, but you have to have that communication with the Social Security office in order for the work incentives to work. And part of that is reporting your earnings. Now, reporting your earnings is different, slightly different for SSI and SSDI. If you have both, you have to report twice in 2 different areas. So the key points is that you are going to have your pay stubs ready to report by the 6th of the month following when you receive those pay stubs. Your first report is going to be by telephone and follow up with your cover letter and pay stubs. And then from there, you have several options of how you can report. And they're listed there on the screen. You have phone, mail, fax, deliver in person to the office, telephone report, use an app on your phone, or create your own My SSA account. And the thing I like to suggest is that with that communication with the Social Security office, that you are asking them, what is your preferred method? Because again, if you are reporting and that information is not being handled, then we have an issue, okay? So next slide, please. Some of the same key pieces for SSDI is, again, you're going to report by the 6th of the month. But the thing here is you may want to look at that My Social Security account. For both areas, you're going to want to have that employer identification number on there. With the My Social Security account, you can enter that, you can upload your pay stubs, and it provides you a record that you have reported your income. And then just always be advised that you need to have communication with that person at that Social Security office so that they're watching for that and they're looking for it and they're updating the record. So you have 5 or 6 different ways that you can report. Just be sure to communicate that with the person at your local office. And I think that's it, right?
Thank you, Liz. Trying to advance to the next slide here. Okay. Just to follow a little bit what Liz was saying as well, we do advise the individual to keep their check stubs. Despite the reporting, there may be occasions where Social Security may request an 821, which is a going back of sorts to accrued past income. And sometimes we at CUH will be proactive in getting the beneficiary or the recipient to go ahead and fill those out and submit them to Social Security. What you see on screen now is our coverage area for both Louisiana Lighthouse WIPA and West South Central WIPA with LSU. LSU is covering the purple shaded areas of the map, and Lighthouse Louisiana is covering the white or light colored areas of this map shown on the screen now. How to refer to WIPA? You can do it directly by calling the WIPA hotline at the toll-free number that you see there. They're available to take your calls Monday through Friday from 8 a.m. to 8 p.m. That would be 7 a.m. to 7 p.m. Central Time. And for general ticket to work inquiries, you may email them at the support@choosework.ssa.gov website here. Here's the contact information for Rose, Liz, and myself. Excuse me, for Rose and Liz. I'll show Liz's contact information in a moment. Here's the West South Central WIPA contact information, our email addresses. For providers, we don't mind taking direct contacts from you using our email addresses. If you're referring individuals to us for assistance, the ticket to work hotline number that you saw on the previous slide would be the best way to get to them. LSU also has a beneficiary referral form on our website at the link that you see on this particular slide here. Here is Liz's contact information with Lighthouse Louisiana. And then I'll go ahead and just give you this disclosure that this presentation and associated materials were developed at U.S. taxpayer expense. These do not constitute an official Social Security communication. Okay. If we have time for any questions, we can go ahead and do our best to answer those now.
We do have a few, Ray, if you guys do have time.
Sure.
Okay. From Dr. Mitchell, if I am in an educational program and or have a job that requires online access, can I exempt the cost of the technology, software, hardware, one-time expenses, and the internet services monthly charges? Which options do I have? Is it related expenses, pass, whatever? How does this differ from SSI and SSDI?
Well, it is possible to use those expenses as impairment-related work expenses. We would have to see if Social Security would approve those expenses. Now, keep in mind, the impairment-related work expenses is used for SSDI to lower countable income to maintain the benefits. For SSI, it's the lower countable income to receive a greater amount of SSI. So it depends on which benefit you're receiving and whether or not Social Security is able to approve the expenses that you are asking about.
Also, like if in a work situation, somebody might be self-employed, it might be a business expense.
It could be.
Yeah,
correct, Rose.
Like the internet and phone, gig economy workers are deducting that as, part of their expenses.
Okay, another attendee asked, so even if the person is getting paid the $1,735 because they are not able to perform the duties, SSDI would allow for 80% of the salary to be counted?
Yes, Social Security would consider that the employer fills out a subsidy form of what they feel that the employee, their work effort is, and they rate them on a percentage. You know, between 1 and 100%, and mark what kind of accommodations they're providing. And Social Security could accept that and regard them as earning the lower amount,
Okay,
even though
thank
they're
you.
bringing
that-
home 1732.
And one last
Right.
question, if, I'm sorry, Donna, you want to add something to that?
Well, the disregard could be less than 80%, or it could be more than 80%. It just depends on the rating that the employer rates the effort by the disabled individual doing the same work as a non-disabled individual. So the accountable income then could be much less than the 1735 or the
Right.
1385 that we listed earlier in the example that Rose had used. Yes, ma'am.
I've seen people rank as low as 50%, you know, to where only half of their earnings are actually counted by Social Security.
Okay, and one last question. When someone becomes eligible for SSI or SSDI, when are they provided with information on these work incentive programs? First-time beneficiaries are not usually aware of their existence.
Generally, when they call Social Security about wanting to go to work, Social Security will refer them to the WIPA that is in that particular state. That's how most of the referrals are generated for our programs. If they contact their local Social Security office and tell them they have an interest in employment with these benefits, they'll be directed to contact us.
Thank you so much, and thank you for staying over. I think our attendees are aware that you guys are a wealth of knowledge, so they wanted to take full benefit of this opportunity. So thank you, Dr. Fussell, Donald, Rose, very informative. Our next session starts at 12. So we're gonna ask everybody, just go grab some lunch and come back and meet us at noon. You